In this video, we'll study about the cavity of the larynx. It extends from the laryngeal inlet up to the lower border of the cricoid cartilage. The anterior wall of the larynx is longer than the posterior wall, as the laryngeal inlet is placed obliquely, sloping downwards and backwards. This is a picture of the coronal section of the larynx to show the interior of the larynx. So when you take the interior of the larynx, it presents three pair of mucous folds. From above downwards, you have the aryepiglottic fold, then you have the vestibular fold, then you have the ocal fold. The space between the two aryepiglottic fold forms the laryngeal inlet. The space between the vestibular fold forms the Rima Vestibuli. The narrow cleft between the ocal fold and the vocal process of the arytenoid cartilage is known as the Rima Glottidis. Next, we'll see the subdivision of the larynx. The interior of the laryngeal cavity is subdivided into three parts. So this part is known as the vestibule. The vestibule, or the upper part, it extends from the aryepiglottic fold to the vestibular fold, and it slopes like a funnel from above downwards and medially. The next subdivision is the sinus of the larynx. So this is a sinus of the larynx, or the intermediate part. It intervenes between the vestibular fold and the ocal fold and presents on each side a deep mucous recess extending laterally towards the lamina of the thyroid cartilage. The absence of the quadrate membrane and the cricovocal membrane in this region permits the mucous lining of the sinus to bulge outwards. A mucous diverticulum, which is known as the saccule of the larynx, opens on each side into the anterior part of the sinus of the larynx. The saccule extends upward blindly, and it is provided with a mucous glands which lubricate the Rima Glottidis. The next part is the infraglottic part, or the lower part. It lies below the ocal fold and it looks like a truncated cone. So next we'll see about the laryngeal inlet. So this is the laryngeal inlet, or adductus laryngis. So it is bounded above and in front by the upper margin of the epiglottis, below and behind by the interarytenoid fold of mucous membrane, on each side by the aryepiglottic fold. The inlet is lined by non-keratinized stratified squamous epithelium. Each aryepiglottic fold contains the aryepiglotticus muscle and the thyroepiglotticus muscle, and two cartilage, the carniculate and the cuneiform cartilage, and the upper free margin of the quadrate membrane. So each aryepiglottic fold contains two muscles, the aryepiglotticus muscle and thyroepiglotticus muscle, two cartilages, the carniculate and the cuneiform cartilage, and the upper free margin of the quadrate membrane. The contraction of the aryepiglotticus muscle closes the laryngeal inlet by approximating the aryepiglottic fold and by bringing the arytenoid cartilage in close contact with the tubercle of the epiglottis. The epiglottis does not fall back to close the inlet like a lid, because it is observed that the surgical resection of the upper part of the epiglottis does not disturb the closure of the inlet. The opening of the inlet is mostly passive, and it is partly assisted by the contraction of the thyroepiglotticus muscle. Now we'll see about the Rima Vestibuli. So it is a space between the two vestibular folds, and each vestibular fold is also known as the ventricular fold or false vocal cord. The vestibular fold is lined by ciliated columnar epithelium, and it contains the submucous areolar tissue and the vestibular ligament. The vestibular ligament is nothing but the thickened lower free margin of the quadrate membrane. So this is a quadrate membrane. The lower free margin is thickened to form the vestibular ligament. So the mucosa, the submucosal areolar tissue and the vestibular ligament together forms the vestibular fold. The free margin of the vestibular fold slopes downwards and medially. So it slopes downwards and medially. Now we'll see the functions of the Rima vestibuli. It permits the air entry in inspiration and prevents the air exit during expiration. Therefore, it acts as an exit valve. Holding of breath at the end of inspiration is done by the opposition of the vestibular fold. This is essential to increase the intra-abdominal or intrathoracic pressure during the act of micturition, defecation, coughing or parturition in female. Next we'll see about the Rima Glottidis. The Rima Glottidis is the narrowest anteroposterior cleft of the laryngeal cavity and it is lined by non-keratinized stratified squamous epithelium and it is devoid of submucous coat. The sagittal diameter of the glottis measures about 23 mm in adult male and 17 mm in adult females. When you see the boundaries of the Rima Glottidis, in front it is bounded by the angle of the thyroid cartilage, behind by the interarytenoid mucous fold. On each side, the ocal fold forms the anterior 3/5 and the ocal process of the arytenoid cartilage forms the posterior 2/5. Next we'll see about the ocal fold. Each fold is pearly white in color. It is lined by stratified squamous non-keratinized epithelium and it is devoid of submucous tissue and contains the ocal ligament medially and the ocalis muscle laterally. The ocal ligament is formed by the thickening of the upper margin of the cricovocal membrane. So this is the cricovocal membrane. It thickens at the upper free margin to form the ocal ligament. The free margin of each ocal fold is directed upward and medially. Now we'll see the subdivisions of the Rima Glottidis. It consists of two parts. The intermembranous part. So this is the intermembranous part in the anterior 3/5 between the ocal folds. And intercartilaginous part in the posterior 2/5 between the ocal process of both arytenoid cartilages. Now we'll see the shapes of the Rima Glottidis. This is the shape when there is a normal quiet breathing. The intermembranous part of the Rima Glottidis is triangular with the apex in front and the intercartilaginous part is rectangular. So the total outline of the Rima is symmetrical and pentagonal. In full inspiration, the glottis widens and becomes the diamond shape due to the abduction of the ocal fold. In high pitched sound, the Rima is reduced to a linear kink due to the adduction of both intermembranous and intercartilaginous part. In whispering sound, the intermembranous part is highly adducted and the intercartilaginous part is separated by a triangular gap. So the total outline is an inverted funnel. So this is in quiet normal breathing and this is in full inspiration and this is in high pitched sound and this is in whispering voice. Next we'll see the movements of the Rima Glottidis. The alteration of the shape of the glottis is produced by the movements of the ocal fold which consist of adduction, abduction, tension and relaxation. First we'll see the abduction. So the abduction is produced by the posterior cricoarytenoid muscle. When the muscle contracts, the muscular process of both arytenoid cartilage rotate medially around a vertical axis passing through the center of each cricoarytenoid joint. As a result, the ocal process of the arytenoid cartilage rotate laterally, producing a diamond-shaped outline of the glottis. The rotatory movement takes place by the contraction of the upper horizontal fibers of the posterior cricoarytenoid muscle. When the lower vertical fibers of the posterior cricoarytenoid muscle contract, the arytenoid are separated from each other by the downward and the lateral gliding at the cricoarytenoid joint. In such condition, the shape of the rima is enlarged, form an enlarged triangular shape. So during abduction of the ocal fold in human larynx, gliding is more pronounced than the rotatory movements. The integrity of the action of the posterior cricoarytenoid muscle saves the life of the subject because in its paralysis, adductor muscle takes an upper hand and the subject might die due to the lack of air entry. Hence, the posterior cricoarytenoid muscle acts as a safety muscle of the larynx. In addition to the abduction, the posterior cricoarytenoid steadies the arytenoid cartilage during the adduction by the contraction of the lateral cricoarytenoid muscle. Next, we'll see about the adduction. The intermembranous part is adducted by the contraction of the lateral cricoarytenoid muscle, which rotates the ocal process medially. So this is the ocal process which rotates medially around the longitudinal axis of the cricoarytenoid joint. This movement takes place in whispering voice, where the shape of the glottis is an inverted funnel shape. The adduction of the intermembranous part by the lateral cricoarytenoid muscle is antagonized by the upper horizontal fibers of the posterior cricoarytenoid muscle. The intercartilaginous part is adducted by the action of the transverse arytenoid muscle and the pair of oblique arytenoid muscle. Here, both arytenoid cartilage are approximated to each other by the medial gliding movement at the cricoarytenoid joint. The adduction of the intercartilaginous part is antagonized by the lower vertical fibers of the posterior cricoarytenoid muscle. In high-pitched voice, both parts of the Rima Glottidis are simultaneously adducted. The tension or the elongation of the vocal cord is produced by the cricothyroid muscle and partly by the ocalis muscle. Next, we'll see the mechanism of action of the cricothyroid muscle. So this is a classic view. When the muscle contracts, the anterior arch of the cricoid cartilage is rotated upwards towards the thyroid cartilage. At the same time, the lamina of the cricoid cartilage rotates backward around a transverse axis passing through both cricothyroid joints. The backward swing of the lamina is associated with the backward displacement of the arytenoid cartilage. Eventually, the distance between the thyroid angle and the ocal process is increased. So, thus the ocal fold is stretched. The next view is the Negus view. Here, the cricoid cartilage is fixed and the thyroid cartilage moves forward by the contraction of the oblique part of the cricothyroid muscle. The movement takes place by the forward gliding at the cricothyroid joint. As a result, the distance between the thyroid angle and the ocal process is increased, producing the tension of the ocal fold. Next, we'll see about the relaxation or the shortening of the vocal cord. So this is mainly done by the thyroarytenoid muscle and the ocalis muscle, and when the thyroarytenoid muscle contract, the vocal folds are shortened due to the approximation of both ends. The ocalis muscle is the detached medial part of the thyroarytenoid muscle and lies within the vocal fold, just lateral and cranial to the vocal ligament. and it is inserted to the lateral surface of the vocal process of the arytenoid cartilage. So when the muscle contracts, the anterior part of the vocal ligament is stretched and the posterior part is relaxed. So during contraction of the vocalis muscle, the thickness of the vocal fold is increased and the segmental tension of the vocal fold helps in the modulation of the voice. Now we'll see the functions of the Rima Glottidis. Since the free margin, so this is the free margin of the vocal fold is directed upwards and medially, the Rima Glottidis permits the air entry during expiration and prevents the air entry during inspiration. Therefore, it acts as an entry valve. So one can hold the breath at the end of the expiration and prevents the next inspiration to follow for some time. This is necessary for the freer movements by some inspiratory muscles, example the pectoralis major muscle and the serratus anterior muscle. So the Rima Glottidis acts in phonation as a voice box. Any sound from the larynx is produced by the vibration of the vocal fold is called the voice. All the vowels are voiced but the consonants are unvoiced in the larynx. The larynx is a tone producing organ and each tone presents a fundamental pitch of the sound, which depends upon the length and the degree of the tension of the vocal fold. Before the production of the laryngeal sound, the vocal folds are adducted and stretched so that the blast of expired air from the lung separates forcibly the vocal folds and set them into a vibratory motion. The mucous membrane of the glottis is adherent to the underlying structures due to the absence of the submucous coat. As a result, the mucus secreting glands are absent in the glottis, and the secretion of the glands of the saccule of the larynx lubricates and it serves as an oil can. When you see the mucous membrane of the larynx is essentially lined by ciliated pseudostratified columnar epithelium, except the aryepiglottic fold, the vocal fold, the upper part of the posterior surface of the epiglottis. These are lined by stratified squamous non-keratinized epithelium. The surface epithelium is provided with the goblet cells and the lamina propria contains the mucus and the serous glands. The taste buds are observed in the surface epithelium of the aryepiglottic fold, the epiglottis and the vestibular folds. Next we'll see the nerve supply of the larynx, the sensory supply. The mucous membrane above the vocal fold is supplied by the internal laryngeal nerve and below the vocal fold is supplied by the recurrent laryngeal nerve. The motor supply, all the intrinsic muscles of the larynx are supplied by the recurrent laryngeal nerve except the cricothyroid, which is supplied by the external laryngeal nerve. The transverse arytenoid muscle presents a double nerve supply by the recurrent laryngeal nerve and the internal laryngeal nerve. The secretomotor supply of the laryngeal gland is derived mostly from the recurrent laryngeal nerve. Next we'll see the blood supply. Above the vocal fold, the larynx is supplied by the superior laryngeal artery, which is a branch from the superior thyroid artery. Below the vocal fold, it is supplied by the inferior laryngeal artery, which is a branch of inferior thyroid artery. The Rima Glottidis presents a dual blood supply. The venous drainage corresponds to the artery. Next we'll see the lymphatic drainage. The lymphatics above the vocal fold drain into the prelaryngeal and the jugulo-digastric lymph node, and below the vocal fold drain into the pretracheal and the paratracheal lymph nodes. Therefore, the Rima Glottidis acts as a watershed line of the larynx. Next we'll see the applied anatomy related to the larynx. When the recurrent laryngeal nerve is cut accidentally on one side during the operation like partial thyroidectomy, the patient will have the following manifestation. The affected half of the Rima Glottidis is fixed in the paramedian position due to the action of the cricothyroid muscle. The sound half of the Rima moves freely and even crosses the midline to meet the opposite side vocal fold. The voice becomes hoarse, but the patient does not complain any difficulty of respiration. In the surgical involvement of both recurrent laryngeal nerve, both half of the Rima Glottidis are fixed in the paramedian position. The patient becomes aphonic and complains of difficulty of respiration on slight exertion. The tracheostomy should be done in this condition. When the recurrent laryngeal nerve and the external laryngeal nerve are involved on both sides, the Rima Glottidis are further abducted and fixed due to the paralysis of all intrinsic muscles of the larynx. This is known as the cadaveric position of the Rima. Sometimes a growing tumor or the vascular aneurysm compresses upon the recurrent laryngeal nerve and produces the manifestation which obeys the Siemens law. So this law states that in chronic involvement of the recurrent laryngeal nerve, the abductors of the larynx are paralyzed first, followed by the other muscles.